Have you ever sliced up a fresh cucumber, sprinkled a little salt on it, and thought this is one of the healthiest snacks I could possibly eat? What if I told you that for some people, especially those over 60 living with diabetes, high blood pressure, or early kidney disease, that simple, innocent plate could quietly push their kidneys toward a medical emergency overnight? This is not fear-mongering. This is something I have seen in real life. I'm Dr. Mark Ellis, and I have treated patients who walked into the emergency room, confused, swollen, short of breath, because of a combination they thought was clean, natural, and completely safe. Their blood pressure spiked, their electrolytes crashed, their creatinine levels shot up, and all of it started with a food they believed was protecting them. Cucumbers are 95% water. They're refreshing, low in calories, and widely recommended in American households for hydration and heart health. But here's the uncomfortable truth. It's not always the food itself that harms you. It's the timing, the combination, and the hidden interactions with medications that can turn something healthy into a silent stress test for your kidneys. And when kidneys are already vulnerable, they don't fail loudly at first. They fail quietly until they don't. In this video, I'm going to show you exactly which 3 combinations can strain your kidneys, far more than you realize, why the science behind them matters, and most importantly, how to keep enjoying cucumbers safely without putting your health at risk. Because this isn't about eliminating foods out of fear. It's about understanding how small daily habits can either protect your kidneys or slowly push them to the edge. Let's start with the combination almost everyone thinks is harmless: cucumbers with salt, soy sauce, or fish sauce. It looks clean. It tastes refreshing. It feels healthy. But this is where the first silent mistake happens, especially in older adults or anyone with high blood pressure, diabetes, or early kidney decline. Here's the science in plain English. Cucumbers naturally contain potassium, not in extreme amounts, but enough to matter when kidneys are already struggling. Now add a heavy splash of sodium from salt or soy sauce. When sodium rises in the bloodstream, your body holds on to water to dilute it. That means more fluid volume, higher blood pressure, and more work for the kidneys to filter. In healthy young adults, the kidneys adjust. In aging kidneys, the system strains. I once treated a 67-year-old man, let's call him Robert. He loved cucumbers, ate them every afternoon, dipped generously in soy sauce because he was cutting carbs and trying to snack clean. One weekend after a family barbecue, he overdid it: salty cucumber salad, grilled meats, processed sides. The next morning, his eyelids were swollen. By noon, his ankles were puffy. His blood pressure had jumped to 178/96. His labs showed elevated creatinine compared to just 2 months prior. Was it just the cucumber? No. It was the sodium load paired with already compromised kidney filtration. Research consistently shows that high sodium intake increases intraglomerular pressure, the pressure inside the tiny filtering units of the kidneys. Over time, that pressure accelerates kidney decline. In people with hypertension, even modest sodium spikes can trigger measurable fluid retention within 24 hours. And when fluid retention happens, the heart works harder, the vessels stiffen, and the kidneys become collateral damage. Now pause for a second. Have you ever dipped cucumber slices into something salty and thought you were making a smart choice? Be honest. Drop a comment below, I read them. Because the problem isn't the vegetable, it's what we pair it with. And small daily pairings become cumulative stress tests for organs that don't regenerate easily. Here's the key shift: you don't have to eliminate cucumbers. But portion control and sodium awareness change everything. A light squeeze of lemon instead of salt, a low sodium seasoning, a smaller serving. These tiny swaps reduce fluid overload dramatically. It's not dramatic detox advice, it's physiological reality. But knowing this alone isn't enough, because the next combination is even more deceptive, marketed as detox, praised on social media, and consumed every morning by people who believe they're protecting their kidneys, when in fact they may be undermining them. Now let's talk about the combination that looks the healthiest, the one trending on TikTok, Instagram Reels, and morning detox blogs: cucumber blended with celery or tomato. It's green, it's fresh. It's labeled as anti-inflammatory, kidney cleansing, metabolism boosting. But sometimes what goes viral isn't what protects you. It's what sounds good in 15 seconds. Here's where the biology gets interesting. Cucumbers contain an enzyme called ascorbate oxidase. On its own, it's harmless. But when you blend cucumber with vitamin C-rich vegetables like tomato or celery, that enzyme can degrade vitamin C rapidly. Vitamin C isn't just a beauty vitamin. It plays a role in vascular integrity and antioxidant protection, including protection of kidney tissue from oxidative stress. When you aggressively blend these ingredients together and let them sit, you may be destroying a significant portion of the very nutrient you thought you were boosting. But the issue doesn't stop there. Large volume vegetable juices, especially low-calorie, low-protein, high-water blends, can create rapid shifts in fluid balance and blood pressure. In older adults, especially those with impaired kidney autoregulation, sudden fluid intake combined with natural diuretic vegetables may temporarily lower blood pressure, leading to dizziness or subtle kidney hypoperfusion. A 2021 review in renal physiology journals highlighted how even mild dehydration or fluctuating blood volume can reduce glomerular filtration efficiency in aging kidneys. That means your detox drink may not detox anything. It may simply stress an already delicate filtration system. I remember a patient, Linda, 62 years old, who started drinking a large cucumber celery tomato smoothie every morning after seeing it promoted as a natural kidney cleanse. Within weeks, she felt bloated, some days, lightheaded on others. Her labs didn't show dramatic failure, but her estimated GFR dipped slightly compared to prior tests. When we reviewed her habits, the pattern stood out. The issue wasn't one smoothie. It was daily high-volume, enzymatically altered vegetable blending without context, no protein, no electrolyte awareness, no medication timing considerations. Let me ask you something directly. Have you ever started a healthy habit because it was trending without checking how it interacts with your medications or your age-related physiology? If that sounds familiar, you're not alone and you're not foolish. You're human. But kidneys don't respond to trends. They respond to pressure, volume, and biochemical reality. Here's the practical fix. If you enjoy cucumbers and tomatoes, eat them fresh and separate when possible. If you blend vegetables, drink them immediately to minimize nutrient degradation. Avoid extreme volumes first thing in the morning if you're on blood pressure medication. Add balance, a small amount of protein or healthy fat to prevent rapid hemodynamic shifts. Health isn't about dramatic detox. It's about stable physiology. But even this isn't the most dangerous scenario. Because what I'm about to explain next doesn't just reduce nutrients or cause subtle strain, it can trigger a cascade that sends someone to the emergency room within hours. And if you take blood pressure or diuretic medication, this part is critical. Now we arrive at the combination that truly worries me, not because it's common, but because when it goes wrong fast. Cucumbers consumed close to the time you take diuretics or blood pressure medication. This is the part most people never consider. It sounds minor, it sounds harmless, but physiologically it can become a perfect storm. Cucumbers have a mild natural diuretic effect. They're about 95% water and contain compounds that encourage urination. Normally that's not a problem. But if you're taking prescription diuretics medications like hydrochlorothiazide or furosemide, your kidneys are already being instructed to excrete more sodium and water. Add a large portion of cucumbers right before or after your medication, and you may unintentionally amplify that effect. Here's what can happen inside the body. Excessive fluid loss reduces blood volume. When blood volume drops too quickly, the kidneys receive less perfusion, less blood flow. The tiny filtration units, the glomeruli, depend on steady pressure to function. If perfusion drops, filtration drops. When filtration drops, creatinine rises. This is what we call pre-renal acute kidney injury. It doesn't mean the kidney tissue is dead, but it does mean it's under stress from lack of blood flow. And that stress can escalate quickly. I treated a 71-year-old patient, let's call her Margaret, who took her morning blood pressure pill with a full glass of water, then followed it with 2 large cucumbers because she felt puffy and wanted to flush things out. By midday, she felt weak, and by afternoon, she was dizzy. When she stood up, the room spun. In the emergency department, her blood pressure had dropped significantly, and her labs showed electrolyte imbalance with a noticeable bump in creatinine. She didn't realize she had doubled the diuretic effect, once from her prescription, once from her food. According to nephrology data, older adults are particularly vulnerable to medication-induced volume depletion because their kidneys have reduced adaptive capacity. Even mild dehydration can reduce GFR by measurable percentages in susceptible individuals. Combine that with antihypertensives that already lower vascular tone, and you create a scenario where blood simply doesn't reach the kidneys efficiently. If you're currently taking medication for blood pressure, heart failure, or swelling, I want you to pause and think, do you ever intentionally eat water-heavy foods right after your pill to help it work better? It may feel logical, but physiology doesn't negotiate. It follows pressure gradients and blood flow. The solution is simple but powerful. Separate cucumber intake from diuretic or blood pressure medication by at least 2 to 3 hours. Keep portions moderate. Monitor for dizziness, sudden fatigue, or increased nighttime urination. Stability, not extremes, protects kidney perfusion. But here's the turning point. You might be thinking, so should I just avoid cucumbers completely? Absolutely not. Because when used correctly, timing and preparation can shift this food from a stressor into a supportive ally. And that empowerment, is where most people finally take back control of their kidney health. So after everything we've discussed, you might be wondering, should you just eliminate cucumbers altogether? Is it safer to avoid them completely? The answer is no. The goal is not fear. The goal is precision. Because when used correctly, cucumbers can still be part of a kidney-conscious lifestyle. The difference isn't the food, it's the strategy. First, timing matters more than most people realize. If you're on blood pressure medication or diuretics, create a 2 to 3 hour buffer before or after taking your pills. This alone dramatically reduces the risk of compounding fluid shifts. Think of it as giving your kidneys space to do one job at a time instead of stacking stressors on top of each other. Second, portion size matters. A few slices with lunch. Very different from 2 large cucumbers in one sitting. The kidneys handle gradual input far better than sudden overload. Large volumes of water-rich foods consumed quickly can change blood pressure and electrolyte balance more than people expect, especially in adults over 60. Third, preparation changes physiology. Instead of pairing cucumbers with heavy sodium, use lemon herbs, olive oil, or light seasoning. If you enjoy blended vegetables, drink them immediately and avoid extreme detox quantities. And if you're prone to feeling cold, light sautéing with warming ingredients like garlic can make them easier to tolerate without triggering digestive discomfort. Fourth, listen to your body. Swollen eyelids in the morning, ankles that leave an imprint when pressed, foamy urine, sudden fatigue, increased nighttime urination. These are not random annoyances, they are feedback signals. The body whispers before it screams, and most kidney decline is gradual, not dramatic. Let me ask you something. Directly, does this feel overwhelming or does it feel empowering? Because once you understand the mechanism, you're no longer guessing. You're making informed decisions. That's the difference between trending advice and evidence-based prevention. The truth is, kidney health is rarely destroyed by one dramatic event. It's shaped by small, repeated habits, smart timing, balanced portions, awareness of medication interactions, stability over extremes. When you apply these principles, cucumbers stop being a risk and start becoming just what they were meant to be: a simple, refreshing food. But here's the deeper takeaway. What we learn from cucumbers isn't just about cucumbers. It's about how everyday healthy choices can quietly interact with age medications and physiology in ways no algorithm warns you about. And once you start thinking this way, critically, calmly, scientifically, you begin protecting not just your kidneys, but your long-term vitality. If there's one thing I hope you take away from today, it's this: you are not fragile, but your kidneys are sensitive. And sensitivity isn't weakness. It's a signal that precision matters. Small changes in timing, portion size, and food combinations can protect you in ways that feel almost invisible day to day, but powerful over years. You don't need extreme diets. You don't need expensive detox plans. You need awareness, balance, and consistency. If this video helped you see cucumbers and everyday healthy habits in a new light, I encourage you to save it. Keep it bookmarked. Share it with someone you care about, especially if they're managing blood pressure, diabetes, or early kidney issues. These conversations can prevent real emergencies. And if you want practical, science-based medical insights that are clear, honest, and designed for real life, make sure you subscribe to the channel and turn on notifications. I regularly share the latest kidney health strategies, medications, safety tips, and early warning signs you should never ignore. Remember, kidney decline is often quiet, but prevention is powerful. The earlier you understand how your body responds to daily habits, the more control you gain over your future. Your kidneys work for you every minute of every day. Treat them with intention and they will serve you far longer than you think possible. I'm Dr. Mark Ellis. Stay informed, stay steady, and take care of your health because it's never too early and never too late to protect it.